Alright, the claim that I'm refuting is that California should offer the option of euthanasia to terminally ill patients. My opponent stated that advocates of voluntary euthanasia emphasize that choice is a fundamental principle for the liberal democracies. But if the choice of euthanasia is given to anyone, then the right to euthanasia will be used loosely and will be abused. An article in the journal Suicide and Life-Threatening Behavior described assisted suicide guidelines for those with a hopeless condition. Hopeless condition was defined to include terminal illness, severe physical or physiological pain, physical or mental deterioration, or a quality of life that is no longer acceptable to the individual. That basically means just about anybody who has a suicidal impulse has a right to euthanasia. So are we to believe that the choice of euthanasia should be given to those who also fit the description of a hopeless condition, to those who simply have no quality of life fit suitable for them? I believe that rather than letting these patients simply give up on their lives, we should be providing them with the aid and careness of finding the correct treatment and medication if necessary, so that they can have a fighting chance at a long and prosperous life. So really, euthanasia becoming available to those under a hopeless condition as well seriously lead to a big problem and to the abusement of the right to euthanasia. Even if this choice is a fundamental principle for liberal democracies, it doesn't mean that it is suitable for everyone. It was stated in a previous speech that the pain and suffering of a person feeling during a disease can be incomprehensible to a person who has not yet gone through it. Although it is true that I could never explain to you how painful it is to have cancer, or to be going through chemo, or to be terminally ill with a deadly disease, I do happen to know of people who make careers out of diagnosing these illnesses and who get paid to understand and cure these illnesses as best as to their ability. Medical doctors have done the time to learn about these pains and know exactly how to treat them, whether that be by prescription medication or a transfer to a better facility who specialize in this. Dr. Saunders argues that patients should end their lives in the place most appropriate to them and their families. A great example of this is St. Christopher's Hospice. This facility is devoted to bringing the greatest comfort and tranquility to these patients who are terminally ill. This argues to be one of the best alternatives to euthanasia. At these places, a consultation team of doctors, nurses, and social workers who have been specially trained in various aspects of terminal care. Interacting with the patient's primary care physicians is an increasingly common way of providing this unique care to these patients. It was also previously stated that hospital beds are being taken up by these terminally ill patients. This claim brings me back to my previous topic of separate facilities that care for these types of patients. It would seem easier to have euthanasia available for these patients over the issues of not enough space in hospitals. When it comes to the sanctity of human life, I believe that it is more humane to provide these patients with the comfort of having their last days on earth being peaceful and lived out in the safety and care of the proper facility, rather than giving the option of euthanasia to them and their families.